What are the top 5 myths about prostate cancer? The first most important myth in terms of prostate cancer that we see here at the Victoria Prostate Centre is that this is an old man's disease. And I would disagree with that wholeheartedly, as more and more patients that we see through our doors here at the Prostate Centre in Victoria is that men are being diagnosed at a much younger age. So this is not a disease that affects men age 75 or plus. This is affecting men in as early as their 40s, and we've seen patients through our doors in that age frame. So this is not an old man disease anymore. This is a disease that is affecting men of all ages. The second myth about prostate cancer that we see through our doors here at the Victoria Prostate Centre is that when diagnosed with prostate cancer, this is a death sentence. And again, I would disagree with that wholeheartedly. Prostate cancer and the advancements in terms of treatments of prostate cancer, men are living longer and longer after having treatment with this disease. It all comes down to men educating themselves about what treatment option is best for them and deciding to move forward with that and having a positive outlook on the diagnosis, because a positive attitude helps increase the outcomes of this disease, and the outcomes of treatment with prostate cancer are increasing more and more on a yearly basis. If diagnosed early, prostate cancer has a 95% success rate for a cure. The third myth about prostate cancer that most men don't understand about this disease is that this is not going to affect them if they don't see any symptoms. Prostate cancer a lot of times is asymptomatic. That's why the importance of annual screening for this disease is so very important. Just because you're not feeling well, just because you don't have any pain, doesn't mean that you might not have a rising PSA or something to be concerned about. That's why at the Victoria Prostate Centre we really emphasize the importance of men at the age of 40 developing a baseline for their PSA so that they know year to year what that looks like. The fourth myth that I would see men have around a diagnosis of prostate cancer is that they need to go in for immediate treatment. With this day and age of aggressive screening for prostate cancer, men are being diagnosed at a much earlier stage of prostate cancer, whereby treatment might not be absolutely necessary at this time. There is a treatment now called active surveillance, whereby men who are diagnosed at an early stage can actually go without invasive treatment and watch their PSA for upwards of 5 or 10 years before it is decided in collaboration with their doctor that treatment might be necessary. So there are men who are living with prostate cancer rather than having to go in and deal with an invasive treatment that would deal with the diagnosis of prostate cancer. So you can live with prostate cancer rather than die of the disease as well. The fifth myth around prostate cancer and men who are diagnosed with this disease is that not all men react as negatively in terms of incontinence or erectile dysfunction as most men might see. Even though they do find that they might have erectile dysfunction or incontinence, that's not always the case for most men. But if they do unfortunately deal with something like erectile dysfunction or incontinence, there are support services available. There are sexual health rehabilitation counselors that are available for patients to access free of charge. And again, it's something that might just be immediately following treatment and is not a lifelong issue. And I think that most men need to realize that they may or may not suffer from these side effects post-treatment, but if they do, there are services that are available.